Today we're going to be interviewing Rosemarie Ray, and Bonnie Broughton, who were both nurses at the Nipigon Memorial Hospital. Was it Nipigon District Memorial Hospital?
Yes.
For a long time. And in the front is a couple of pictures from a scrapbook that Bonnie brought along, and we just wanted to focus on a bit of the old hospital, because the Nipigon Hospital has been rebuilt and renovated many, many times. So maybe, Rosemarie, you could start by telling us maybe why you became a nurse and when.
Well, it's always something I wanted to do. And I had planned right through high school that that was what I was going to do. I was going to go into nursing school. Don't know why, it was just there. So when I was, the year before I graduated and went to school, I did apply for a candy striper position at the hospital. It's like a nurse's aide. I don't think they even have them anymore. They called us candy stripers because we wore pink and red pinafores. And we did things like help give out trays and take the tuck cart around. And while I was there and I saw all the hustle and bustle and saw real nurses in action, that just solidified that I was going to do that. And I think I actually started school, nursing school, around the time that they were doing the new renovations at the hospital. So when I graduated and got hired there, and sorry, I can't remember what year that might have been, early 70s, I'm going to say, I was technically starting at a brand new building, although the old part was still there.
And is that the year then that Gladys Gordon was the administrator?
I believe she was still.
When that changed, right?
Yes.
From the old to the new then, right?
Yes.
Okay. So the new, by you mean the new, but it was an addition.
It was an addition to the
one.
old hospital,
To
but
the old.
the old hospital was not really, it was like doctor's offices
Right, I
and
remember
things.
that.
It wasn't actually part of, we didn't actually work there.
Right. Okay. Okay. So Bonnie, tell us about your reason for nursing.
Well, from very little, we used to play doctor and nurse. And it was something I wanted to do all the time. And I graduated in 1970, and things are very much different. I think, I'm probably the only nurse I know in Ontario anyway that wore her nurse's cap to the very last day. But we mentioned a little bit before that they just wear their hats for the pinning. And Rosie, you said why?
Well, for me it started off because there was a time I worked in Nipigon and then I was in Alberta for a while, and I worked on a orthopedic surgery floor. So lots of tractions and things like that, and our hats were always getting knocked off. Constantly on the traction, on the curtains, everything. So when I came back, I noticed other nurses weren't wearing their hats, so I didn't either. And the other thing is, sometimes the lab would swab various things within the hospital to see what was growing germs, and caps was a big thing.
Wow. Because you're going like this all the time.
Yeah.
Oh.
That's why you had to, I put mine through the, what do you call that thing?
Sterilized,
Yeah.
obviously.
Yeah.
Right.
I see, it was, you just had to do that every once in a while.
But anyway, Bonnie, that was your trademark. Everybody knew when they saw
Yeah.
the cap coming down the hall that
Yeah.
Bonnie was there.
Yeah.
And that's a tribute to you
Yeah.
and your dedication to that.
Yeah.
Yes. But more and more we other people didn't, so then I just stopped. It went into my locker and I didn't put it on again. But we did have, like when we graduated, we had caps, and the ones we had when I was part of the Lakehead Regional School of Nursing, the very first class. And the caps they designed for us, they wanted it a little bit different, but we didn't like them. They looked like stewardess caps. So we designed new caps, and that's what we graduated with. They were more in line with them.
And it was
Yeah,
always
schools.
white uniforms.
Right.
Yes.
I remember Mrs. Spurka, we went to the pale pink and green And she'd arrest right now. You can't even tell who a nurse is.
Right.
Yeah. Another thing that's really different are the wages. I started back in 1979 for $58.62 a day. Now it's just about an hour. It's crazy, the difference.
Where did you first work, Bonnie?
Well, I'm from Saskatchewan, so I worked in North Battleford for 8 years on OBS, obstetrics, and then I went to Regina on a medical intern teaching unit, and then I met Marvin and came to Nipigon, where I worked for, 35 or 40 years, just about 40 years.
And how many years were you, Rosie?
I think it was close to 40.
40, I think I remember that.
But that was two. I was here, and then I went to Red Deer and Geraldton, and then came back here.
Oh, okay. So you've seen other hospitals too, but I can imagine when you go to the regional now, you must shake your head sometimes because everything is so different. So different. And especially when you were talking about uniforms, and Rosie was saying, one of you were saying they got lanyards now, so you know who the nurse is in the hospital, because you can't tell the nurse from the custodian sometimes when you go into a hospital.
And when I worked, started, there was I don't think there was a male nurse. Now there is, and same with doctors. There was only one was Mary Lynn Jackson Hughes. They were all male.
Right.
Interesting how times have changed.
Well, I
For
think
the better.
when I graduated, there was maybe 3, but I think only one of them continued on as male nurse.
And it's too bad because they are such a vital part for older men, especially who prefer that, and it's nice to see, that's for sure.
Yeah.
Well, we used to have orderlies,
Yes.
and that was very helpful.
Tell what an orderly was then, Bonnie.
A male that helped with heavy lifting.
Yeah, and almost like a nurse's aide. Like there was, when they did surgery there, if there was a male procedure to be done that needed shaving, the orderlies would do that.
Yeah.
Oh, okay. And did Nipigon have orderlies?
Yes,
Yeah.
Yes, we did.
we did. Yeah.
Oh, okay. You got to turn the camera around, Zach? Oh, okay. I just guess that's something I don't remember.
Oh, yeah, we had a couple. There was one other that I remember. He was there, and like they were a big help, especially, if people were they came in inebriated and got a little aggressive. Just having a male presence there sometimes made the difference.
Right. Well, I just know when I injured myself a few years ago, it ended up that the fellow from the X-ray unit came and helped because there was nobody there to get me out of the car. But he had the know-how to do it and help. And you're right, it makes a difference if somebody knows and maybe has had a bit of training in doing that. Right. So tell us a little bit about maybe the layout of the hospital, the change from no birthing of babies, those kind of things. And I don't even remember why there was no.
Oh, because of the high insurance rates.
Oh, okay, right.
Yeah. The doctors were feeling they didn't do it enough to keep up, to warrant the insurance rates they had to pay, or even to keep up their level of competency to do it. Some of them would go to Thunder Bay for a day or so and deliver in Thunder Bay to keep that up, to keep their skills up. But when some of the newer ones came, they just didn't feel it was practical.
That's too bad. I can remember reading facts and figures where, oh my gosh, I was amazed. There was, 30 babies born in a year in Nipigon. And so I can see you're right, Rosie. They kept up their expertise doing it there. And then I think things get a little bit complicated. So when you're talking about insurance rates, the hospital had to pay that for the doctors, or the doctors
I
had to
think
pay
the
it?
doctors had to pay that.
They had to pay that themselves.
Plus, if anything went wrong, you're an hour and a half away. We didn't really have a lot of air ambulance, air transport then. So, and sometimes you don't know if something's going to go wrong until it does.
Right.
So in Thunder Bay, you're just, in fact now, I don't know if they did then, but now they'll do the section right there. if they need to.
Yeah.
Right.
And if not, you're just, a few doors away from an OR where they can do a section or whatever they need to do. Whereas having to get an ambulance, get them to Thunder Bay, and hope everything's going to stay okay
Right.
until they get there. And so that was an issue too.
Okay, so were both of you working there at all? Was there ever surgery at our hospital?
There was, yes, tonsils, I think appendixes.
Oh,
Minor
Minor.
things.
I've forgotten those
Yeah.
kind of things, right?
Yeah. And again, because when the newer doctors came, they weren't comfortable doing anesthetics for the same reason.
Okay.
So, and for a while, I think they did go to Thunder Bay, maybe spend a day in the OR with somebody and do some, but they just didn't feel they did it enough to be comfortable doing it.
Which makes sense for them, for sure.
Yes.
For sure. Yeah.
And I can remember folding, we had cloth diapers, had to fold them. There was no such thing as Pampers.
Right.
And also all your instruments to be autoclaved on night shift, we would fold them and package them
Yeah.
just so and put that tape on. Yeah, it was very interesting.
Which I found was shocking to me when I went and found that lots of instruments are disposable now.
Oh, I would
Yes.
think most
Oh.
of them are.
Wow.
Yeah,
I
most-
was
Yeah.
totally shocked when I realized that. So I don't know if it's a waste or is it easier to dispose of them to use the autoclave.
I am not
Wow.
sure, but
When you think across Canada, all those instruments in a
Yeah.
day are destroyed, I guess.
oh yeah,
Yeah,
they are.
or just thrown out. And they are, some of them are like plastic, which is not good for the environment. And some of them, I think part of the reason for that, like single-use kits for like sutures and stuff like that, does go back to preventing infections.
okay.
Because they're single-use, you throw them out, and
Right.
so there's no danger of cross-contamination.
Right.
But
And
they're
then
not getting
Dr.
totally
Hardy,
clean.
remember he used to collect, and they sent them to other countries.
Yes, Rosie mentioned that at the beginning of all the equipment often that
Yeah.
Jerome
Yeah.
had collected over the
Yeah.
years, right?
Yeah.
Gone to different places.
Yes,
Right.
yeah, well, and over the years, every time we upgraded our monitors or our bassinets or anything, he got those too and
Right.
sent them elsewhere. They were
That's good
obsolete
because
for us.
nothing was wasted, really.
That's
And
right.
they weren't just thrown out. They were
That's right.
were passed on.
Yeah.
Right.
Yes,
So the other thing that you touched on was the fact that there was a tuck shop in those
Oh,
days,
yeah.
and then there was 2 hospital auxiliaries,
Exactly.
which we really don't have today either.
No.
No, and they had quite a big role played in raising money for
That's
the
right.
hospital.
yes.
Right, right,
They still do to some degree, right?
Right.
I mean, there's the Chris Kringle and
right, right.
I'm not sure what else they do, but what
Right.
is that? And
And
That was
then-
too
but
bad
not-
because the tuck shop was always an interesting place
It was.
for them to visit
Yeah.
and to provide things for the patients.
Yeah. And then we were
Yes.
the first hospital along the North Shore for streptokinase. It's a clot busting drug for heart attacks. That was very interesting too.
it was, yeah, and it
And
saved,
yeah.
probably saved a lot of people because again, by the time you get them to Thunder Bay, where
That's
they
right.
can do it,
So how did Nipigon get to be that? Can you remember, Bonnie? Was it the doctor maybe who?
I imagine it would have been the doctors. I just remember studying and
push for it
learning.
and take the training and
Exactly.
was that in Dr. Wilson's time?
I think so.
Because
he was
he
very
was
instrumental.
he was yeah, and he was very teaching was his thing.
Oh,
He liked to
okay.
teach,
Yeah.
and anything new like that, he would help with the training and things like that. So yeah, that
So
was
between the two of you, when you're talking doctors, you've seen a lot of doctors
Oh,
come
my.
and go.
we
I
have.
probably have 5 or 6 pages in my books of the doctors that
Right.
have gone.
And the
Yeah.
times when they lived here.
That's right.
And now they don't really
Yeah.
live here, right?
Well, I made just a brief list,
Okay.
like Dr. Jackson Hughes and his ex-wife Mary Lynn, Paul Morby, Dr. Summerlee, Richard Ahi, Art Weeb, Bill Crawford. Those were the early ones, and then there's tons after that. Like I say, there's 4 or 5 pages of them.
Dr. Puttock, Dr.
Yeah.
Bauman, Dr. Corkla.
Oh yeah,
That's the one from Red Rock that used to come
Yes.
across on the ice.
Dr. Crawford.
The early one.
Oh, Dr.
Oh,
Sittlinger.
Dr. Sittlinger, yeah.
Right, yeah. He was well known
Yeah.
for coming over in
Yeah.
the wintertime.
Dr. Jackson Hughes was chief of staff for many, many years.
Yeah.
He's good.
Yeah, of the 4, when I started, of the 4 that were here, 2 of them are now gone, Dr. Workington and Dr. Summerly.
Right, right.
And I didn't see Dr. Sittlinger this summer. Usually comes in the summer. I usually run into him somewhere, but I didn't this year.
And when I graduated, it was 2-year nursing program. Now everything is a 4-year degree course, and you can go in the advanced course. Our granddaughter she did the 4-year in 2.5 years.
Wow.
So that's very comprehensive. Yeah.
Very intense, I would
Very,
think, right?
yes.
Yeah.
Yeah. Yeah.
Oh, there's just so many changes. Just even talk about the difference in medication.
Oh my.
From, you
Yeah.
used to have a dispensary?
Yes.
There isn't now, though, is there?
We do have a
we
pharmacy
still
still.
is.
We still have one.
Yeah.
Oh, okay.
Yeah.
Something I wouldn't have thought of. I just know you get a prescription, go to the drugstore. But
Yes,
No.
but for the drugs we use in hospital, they do at least on long-term care. We have a pharmacist that,
oh, okay.
or that looks after the pharmacy, and she keeps long-term or acute care supplied. Long-term care comes from elsewhere, but
Okay. But you must have seen a big change in the medications.
Oh my.
oh yes, some
Over
of the
the
drugs
years.
probably that we learned in school they
Oh.
don't even use anymore.
Exactly.
Yeah, yeah,
Yeah.
for sure.
And I worked part-time when I had the kids, and it was like you really had to keep up, because just back then we didn't have a year's maternity leave either. I came back in, I think, 6 weeks with the kids.
Wow.
I worked permanent nights so that then I could be home with the kids, and Marvin would watch them after supper. We just had 8-hour shifts back then too, which was different. Yeah.
Do you think the 12-hour shifts were better than an 8-hour shift? Some people have.
I like them, yes. More continuity of care, and also more time off.
Yes.
That was a
The only
big
reason
thing.
I didn't like to change was for the same as you. I worked straight nights, so then I was home during the day with the kids. They were in school at the time, and that kind of went out the window when they went for the 12 hours. And
Right. Okay, the second segment on the hospital, we've talked Zach into joining the 2 ladies because
Yes.
Zach has lots of information behind the scenes and working at the hospital. So Zach, you give us a clue as to what you did then.
Oh, well, I remember when I graduated college, I graduated first as an orderly, and I started in men's surgical the next day. I was hired in Thunder Bay first, a month before I graduated, because jobs, they were so plentiful then that they snapped you up right away and hired you. And I asked her, I said, how do you know I'm going to graduate? And she says to me, well, you're going to, because I've already got you on the schedule. So, and that's where I started my career, was Perth General. And then I worked there for a while. I came to Nipigon. I drove ambulance here. It was volunteer back then. The ambulance was a van, the old blue and white van.
Sure.
And I remember working with Irene Hedican. Not Irene, Linda Hedican from Dorian.
Oh, yes, Linda.
And her and I were partners. And that was all volunteer back then. You carried a pager and the nurses would call you.
Sure.
Remember?
Oh my goodness.
And you just give us our instruction. We'd run up, grab it, and head out. And that's how we did it back then. And we didn't do a lot. There was not like the paramedics now. It was sort of pick up, do first aid, get them to emerge, depending on what it was.
Who would have made the decision, Bonnie, then to call the paramedic?
Well, it would be the hospital.
Yeah.
They'd phone in to us, and
Yeah, there was no central dispatch then.
No.
The hospitals answered for the ambulance phone.
Okay.
They would page us. We would go. There was no dispatch center for ambulances then. Every hospital had their own ambulance service
yeah.
Okay.
back then.
Because I can remember there talk of there being a station wagon in Nipigon at one time that transported people back
It was an
and
ambulance,
forth.
but that's how old the ambulances were. They were station wagons at one time. Then they moved to a smaller van. Now they have the big trucks, but they do a lot more now
Right.
with starting IVs and,
Oh,
and medications and
medications.
getting stuff started when they're going to Thunder Bay for a stroke patient.
Yeah.
You know, because you have a 4-hour
So,
window.
how much more education are those people required than, say, a nurse or an orderly?
The orderly program back then was 9 months. Yeah. The RNA back then was a year, and then they went to 2 years. So the RNA program now is more or less the college nursing program that was back then. That was the 2-year program.
Okay.
And now the RNs are taking the university program, which is 4 years. So they've changed the scope of practice a lot for the RPN.
Yeah. And
'Cause-
PSWs.
And PSWs now are their scope of practice. They're a year course now, and they want to regulate them.
So where did you go to school then, Rosie?
I was at the Lakehead Regional School of Nursing the very first year.
Oh, the very first
very
year.
first class, and that eventually evolved then to they started working out of Con College, and then evolved to the 4-year program. When I went, it was a 2+1 program, so two years in the classroom with a little bit of hands-on on the wards, and the whole last year was on the nursing floor. You got to choose 3 specialties where you wanted to do that year.
So where did you go, Bonnie?
I was in Saskatoon, Saskatchewan Institute of Applied Arts and Science,
Oh.
SIAS for short.
Okay.
Yeah.
Okay. And then Zach, you went.
It's Confederation College, but they taught us at the old Hogarth Hospital. That's where the classroom was.
Okay.
And then we did our practical in long-term care, acute care, rehab. So they moved us around. And some, like acute care was a longer session. It would be like a 3 to 4 week practical. And you went there every day, and you were buddied with a staff member.
Oh, okay.
And then my teacher would come and check on us, talk to our preceptor, and see how we were doing.
Okay.
That's
so,
another thing we did.
okay. Talk about that, Bonnie.
I had, I think 3 or 4 nurses that I was preceptor for.
Mm-hmm.
In fact, even one came and stayed with us during her period.
Yeah.
It was really,
But yeah, preceptorship became very big.
yeah.
And because then the teacher could float, because they would have students at all the facilities. So when you were preceptor with somebody, that person worked with you, and you would do the meds, and they would check stuff with you, and that would go on as just a part of your marks.
Oh, okay. Okay.
I still am in contact with 3 of them, and they said, I remember my first day when you said treat them as though they were your mom and dad or grandma and grandpa, and she said I have never forgotten that. It
And that
makes a
is so
big
true.
difference.
You're
if
right.
you-
That's so true.
If you do
Right.
that.
Explain again. We were just talking off camera about the back rubs. That's really interesting. Just talk.
Yes. Oh, that was the time where you could spend with your patient and see how they're feeling, or even get to know them better with their families, or
Yeah.
And you didn't. I don't think you needed as many sleeping pills either.
Yeah, when I started, once visiting hours were over, everybody got back rubs, and anybody that was in the bed from surgery that couldn't get up got a full wash in the evening as well, and back rub.
Yes.
And everybody got done every day.
Well, the back rubs were sort of to prevent bed sores so much too, eh?
Yeah, but it wasn't just the people that were in bed all the time that got the back rubs. It was everybody.
Everybody got them.
It didn't matter if you were in
Yeah.
there for a sore throat or whatever.
Yeah.
You got offered. Maybe some people maybe weren't comfortable with it, but everybody got offered a back
Anybody,
rub.
yeah.
It was part of the settling down routine in the evenings.
Yeah.
And anybody, like the ones that were ambulatory, got the rubs, and the ones that were bedridden got a wash, full wash,
Yeah.
head to toe.
Wow. Yeah, as you say, that's a time, eh? That
yeah.
there isn't that time anymore.
No.
I wonder why.
Yeah.
Computers are supposed to make more time, but I'm not
Yeah.
sure of that.
I think eventually it will once everything switches
Yeah.
to digital. You're
Yes.
still running a dual system sometimes.
Right.
But
right.
yeah, I remember the years too. Patients smoked in their rooms,
Oh yes, talk about that.
and we used to smoke at the nursing station, Tartan.
Exactly.
Back in the day, and
Exactly.
patients would smoke. They'd have their ashtray on their table and their nightstand, and Yeah.
So who brought, well, of course they could buy cigarettes at the tuck shop.
Yes,
Yes,
tuck
they
shops
would
sell
sell
cigarettes.
them,
You could buy them anywhere.
Right, right.
They'd come around with the cart and they could sell cigarettes, chips, pop.
So was there a time when one patient smoked and one didn't and they had to put up with that? Or was there a no
Oh, yeah.
smoking room?
No,
Oh, it was just like on the buses when I
Yeah.
rode from
Yeah.
North Battleford home. Yeah,
Buses,
it-
planes, they
you
smoked.
came off the bus, you were just blue, and your eyes were watering, and
Yeah.
you smelled of liquor.
Do you ever remember there being an accident with a fire at all from smoking?
I remember walking to patient's room one night and he was sleeping and his bedspread was starting to, it was glowing. It hadn't burst into flames yet.
Wow.
But back in those days, that was part of you knew.
Sure,
And the ones that smoked, you just checked them and
sure. Oh yeah,
Wow.
yeah.
Of course, you had to be careful. Rooms where there was oxygen running, of course,
Yes.
there was no smoking allowed.
Of course, of course. So can you
Other than
remember a
that-
little bit as it started to change then to no smoking?
it.
I think it did start in the old hospital where they started realizing how bad smoking is for you, and they started saying, "Well, no smoking in the hospital, but a doctor could order may smoke in room." Still, but it wasn't when we moved to the new hospital. Then there was no smoking in the hospital at all. They had a little area down in long-term care. Because that was their home, so the smokers there had to be allowed to smoke. So they had a little section that was specially vented. That was right across from the nurse's station. But everybody else on acute care was supposed to go outside to smoke.
And now even long-term care, they have to smoke outside.
Yeah.
Okay.
Yeah, because
well,
the
they-
cost of
yeah.
venting it properly is too much.
Yeah. Is that why?
Yeah.
I just thought because
Well, that was
The
part of the reason
smokers, there were no
budgeting for the
smokers
venting
there for a
system,
while,
because somebody would
and
have
they-
to go in and empty the ashtray every time it was used.
Oh right.
Yeah, it's it's just not cost effective.
Right.
But I remember when I started, they said no smoking on the floor, but you could smoke in the cafeteria. So they sort of moved it off the floor, and staff could smoke at lunch. Then they moved it outside.
and now he can't even be on the property.
No, now you have to be off the property.
Unfortunately, we all know that that doesn't ever hold water because there's still smoking outside.
Oh,
the
yeah.
regional
Oh,
and our
yes.
hospital, so I imagine it
Yes.
happens everywhere. It's too bad, but at least it's cut down 90% maybe.
Yeah.
Yes.
And they had,
Yeah.
and then public places, not just hospitals, they made the smoking had to be 9 meters from the main entrance of a public entrance. So,
Right.
yeah.
Made a big difference just to the air quality in a hospital then, especially if you were a non-smoker.
Yeah.
Right, right. So talk a little bit too. I remember the time when you had the cafeteria there, and I can remember the public. I don't know if they still do. The public could go there and get a lunch.
Sure they
I
still
can.
remember
Yeah.
them
Sure.
serving lunch to the hospital auxiliary. We would go there and they would
Yeah.
serve us lunch too. I don't know
You
if
can
that's
still get lunch
Yeah, you
at
can still
Nipigon
go
Hospital.
there.
You can just, tap at the door and they'll tell you what the special is and you
oh,
can
you
order.
still can.
Yeah.
Okay.
Yeah.
Is there a difference in the kitchen and the food type of thing from when you first started? You think?
I think the food has improved over the years because I can remember in the old hospital they would have on the menu there would be Salisbury steak, there would be Swiss steak, there would be hamburger steak, and all of it was the frozen beef patties with a different topping on it.
Wow.
And you get that, I don't know, a couple times a week. But the breakfasts there was always eggs and there was usually a hot cereal. That has changed a lot. Now it's pretty much just toast and cereal.
Yeah. And a lot of the
For
food now that
breakfast,
used to cook in-house is now all quick, frozen, French fries, chicken burgers.
No.
Yeah, they don't,
Nothing.
where they used to make everything in-house before. And that's the same with the hospitals in Thunder Bay as well. They're on a quick chill system. It's all pre-made. They put it in the warmers.
Which is too bad, really.
It is.
It's too bad. I guess maybe it's still healthy, but not as healthy as it could be. Right.
Yeah.
I can remember too, they had what was called an adjuvant for the long-term care, and Donna Halverson, and they used to make fresh bread.
Oh, yeah.
Oh, we just loved that. You could just smell it coming up the hall, and then they'd bring us a sampling.
And the seniors had something to do because they would help out or sit with her, and they'd
Sure.
make the bread and have some afterwards, and they'd bake it right there, and they could watch it. So it was
just
something
like
for them to
they
do.
did in the
Yeah.
olden days too.
And
It
then
brought
they-
back lots of memories.
Yeah. And then they would sell them to raise some money for long-term care, because we had a little lady there famous for her cinnamon buns.
Yeah.
And so when she ended up in long-term care, that's what they did. Once a month or a week or whatever, they would make these cinnamon buns, and then they would sell them.
Ah. So can you remember when that transition happened for the long term? Like who would have been involved? Was it a push from the town? Was it a push from the hospitals? What was the push to introduce long-term care?
Well, I think it started when they started planning for the new hospital. They started planning for a long-term care wing. And, well, we did, our CEO at the time did get himself elected onto council to make sure that new hospital happened and the long-term care wing happened. And it became apparent in the old hospital, because we'd always have at least 5 or 6 beds that were taken up with people that just couldn't be at home anymore. So
And
the
I
need...
I'm sorry. I can remember too. They gave us the choice. Did we want to stay on acute care, or did we want to go down to long-term care?
Okay.
A lot of it is financing too, because acute care is financed with a bundle of money, and long-term care is financed by numbers. So when you're in a hospital on the acute care side, the longer you stay, the hospital isn't making money then. See, long-term care is funded by numbers. So they do RAI assessments, what they're called now, on each client every 3 months. That gears your funding.
Okay.
So it's funded totally different for all their medications. The medications are resourced out. So when you're in an acute care bed, if you're deemed long-term care or transitional care, then you start paying for your bed. Yeah, so the funding's totally different for long-term, so that's why they try to get them off an acute care hospital bed into a long-term bed.
Right.
Or a transitional unit like St. Joe's.
Yeah.
Right. So I mean, we're fortunate we do have the long-term care. We really are, because we have so many elderly people, and I think that's in every community now, isn't it? But it's more so here when we don't have outside private facilities for some of those people.
And also, the younger generation don't take care of their parents.
No.
I can remember my grandma being with us until
Right.
she passed away.
Right.
Marvin's folks, they all passed away at home.
Right.
Things like that.
Yeah, it's interesting to see the change up there.
I'd say a lot of it is years ago too. The husband might have worked and the wife stayed home.
Right.
So you have the resources where now everybody has to work.
That's right.
With the price of stuff and the way things are going, both parents have to work full time to make ends meet.
Right.
And it's just not there anymore for having the resources at home to take care of an elderly person.
Right.
Especially depends how much care they need. If they wander or they're, they need maybe a little bit more care or need to be more in a more structured
Right.
environment.
Where they can wear, like we have alarms that they wear like a watch. If they get near an exit, it'll go off. If they're a wanderer.
And the door will lock, so they
the door's
can't.
locked.
It won't open for them.
Right.
So those kind of people you couldn't leave at home and go to work.
Right.
So, and like I said, this generation now, both parents have to work in order to make ends
Yeah.
meet
Right.
with the cost of living.
So when you were in your early years, do you remember if there was as much dementia or Alzheimer's as there is today?
There probably was, but it wasn't
Labeled.
labeled.
It wasn't labeled then. I often think about that
Yeah,
because it's so prevalent now.
yeah.
Or maybe you say it's the diagnosis now.
It's diagnosed where it was before they didn't really maybe know what it was. It was a lot of, they would say, well, it was old
Or
age.
they're confused.
Or they're confused, and
Oh, they just had a bad night.
yeah.
Yeah.
Or
I-
maybe the medication, sometimes blaming
Yeah.
on whatever medication they're
Yeah.
taking.
And the more research they did, then they discover things and
Yeah.
then have a name for something. Then you know what you're working with. Where years ago you didn't know what you were dealing with. Where now you can sort of research and know what to expect.
Right.
Yeah.
Right.
And some of those dementias are often diagnosed in younger people. like, you don't have to be in your 80s. We had
No.
one poor gentleman there was just in his 50s.
Yeah.
Yes, yes, for sure, for sure. No, I just see when I even look at the layout of the hospital, how things have changed, because you said, Rosie, when they were planning that hospital, they were planning for long-term care, but my gosh, how many renovations have been done inside there?
Yeah.
Again, the most recent was just reconfigurating where the health team is. And the long urgent care clinic, I get
Yeah.
mind-boggling to me that it keeps changing like that. And no occupational therapy so much now. It's just therapy, physical therapy, eh? Physio. But we had those separate ones.
But things
Yeah.
change,
Yeah.
times change, and different things change, and
Yeah.
you know, different teams now work with different stuff. So you're not always just going to the doctor's office. Your family health teams are that can help you. Where you have your diabetes nurse, so you don't really have to see the doctor. You just have to see them.
Right.
So you know, where before you always went to the doctor's office, no matter what you had.
That's right.
Now the teams are split up, so you don't have to go to them, and they report back with. And this is where the digital chart comes in. They can see the chart from the office when somebody's documenting in another building. So it's made it better that way, where the doctor can pull up x-rays now on a computer. You have an x-ray done here in Nipigon, the doctor and the radiologist can see it right away.
And then that x-ray gets sent to Thunder Bay if necessary.
No, it doesn't have
No,
to
he
send it. It's
sees
all
it on-
digital now.
Oh,
You
did
can
you?
see it
Well,
on the
Yeah.
computer.
I meant,
computer.
I meant by computer.
Yeah,
Yes.
but
Yeah.
once they take it, he can see it right away.
Okay.
And that's the same now with telemedicine. Doctors in Toronto can instruct doctors in Thunder Bay during a conference how to do a surgery.
Yes.
So
And
it's
lots
advanced.
of appointments now are done by telemedicine.
Yes.
Yes, they are. Yeah,
So you're not flying to Toronto to see a doctor for a day if you
Right.
can do it by telemedicine.
right. Yeah, and then you're right. That's the computer part of the whole thing.
Yeah,
eh?
so you can see
As
each
you
other
said,
on the
Bonnie,
screen.
it's overwhelming.
Yeah.
But
But it's
It's-
really good.
yes,
Like,
yeah.
and the younger generation, I mean, that's what they know from kindergarten. Or,
Yeah.
When I did
Yeah.
telemedicine,
Yeah.
it was when I started at McKellar, it was just pediatrics to sick kids. Now it's grown to be a whole department in its own, with offices and cameras to look at wounds and scopes to look in ears and stuff, so they can put it, you know, and the doctor in Toronto can see inside the ear, or he'll tell you to move it around so you can see a tissue.
Even stethoscopes. You
Yeah.
can put a stethoscope on a patient's chest here,
Yeah.
and they will hear
In Toronto.
in Toronto or Thunder Bay or
Yeah, and you can hook it up to a monitor so they can actually see the monitor
Oh,
going
my.
on. They'll tell you, okay, move it to the left, move it to the apex, move it, and they'll tell you, and you do, and he can listen in and watch it and give you a diagnosis and tell you what medications to start.
so nobody should be dying today because you've got all,
But like
all
everything
that.
else, things get booked up, and you're on a wait list.
that's
Yeah.
right.
Yes. Yes.
So
That's another thing with patients in the hallways.
yeah,
We had that; they have it now. There's
Yeah.
just not enough.
Not even.
yeah.
No.
Oh yeah, we used to have one time we had babies in playpens.
okay.
So Zach is going to pause from this interview and come and adjust the camera.